Hi, Dr. Tashakkor. How are you?
Hi, Madeleine. Can you hear me?
I can hear you just
Okay.
fine. Thanks so much for joining.
My pleasure. Happy to be here. How are you?
I am doing really well. It's been a busy day, but a really great one. How about yours?
Very good. Busy day, but I'm happy to be here and talk about retinol.
Amazing. Yeah, so I see we've got about 15 people joining us already, so that's amazing. Thanks so much for tuning in. I'll just quickly introduce myself. I'll introduce you, Dr. Tashakkor, and we can kind of get started. So
Perfect.
my name's Madeleine. I work for SkinCeuticals, and tonight I'm partnering with Dr. Tashakkor and Nexx on some retinol education. Uh, so Dr. Tashakkor is our expert tonight, and he is actually an expert in non-surgical, minimally invasive techniques for facial enhancement. He's an American and Canadian board-certified aesthetic and internal medicine specialist, as well as an award-winning author that has been published in more than 30 scientific articles in renowned medical journals, including Plastic and Reconstructive Surgery, as well as the Canadian Journal for Plastic Surgery. He's also a recipient of the Canadian Millennium Excellence Award. So quite the resume. I'm so grateful to have the opportunity to work with you and to speak with you tonight and to share your expertise with our audience. So um, I'll let you take it away from there.
Perfect. Good afternoon, everyone. Thank you for joining in. Thank you for the warm introduction. It's just a pleasure to be here, and yeah, happy to chat. Thank you for the invite.
Amazing. Yeah, absolutely. Um, I guess the purpose from tonight was to share your expertise about retinol. I know this is such kind of a hot topic nowadays, and I personally, in my work, get tons of questions all the time about what retinol is and how to properly use it. And I think we would all love to hear your thoughts on this and to give us some advice on kind of how to incorporate this into our routines. Um, so I guess we can kind of start at the beginning. Would you tell us and share with us a little bit about like what retinol is?
For sure. So, and Madeline, I'm happy to entertain any questions as well as we go. I prefer that this is
Absolutely.
very informal and we can actually answer everyone's questions. So, retinol is the powerful derivative of vitamin A. As many people might know, vitamin A is an essential component for cell function, particularly in the skin cells. And so retinol A is basically a vitamin A derivative. It has different implications within dermatology. It's actually one of the most well-studied ingredients historically in dermatology and has different applications ranging from treatment of hyperpigmentation, photo aging, treatment of acne, and yeah, so yeah,
The ingredient that does it all. So can you share with us, like, I think I always wonder, like, how exactly does it work? So it works on acne and pigmentation and anti-aging. Like, what exactly is retinol doing in the skin?
for sure. I think it's important to talk about how it works because then later on when we talked about some of the side effects or changes that the clients might experience, we can refer back to how it works and it makes sense to people. So it works at the level of the skin cell. It communicates with the DNA of the cell. And depending on its indication, it works slightly differently. For example, retinol is one of the best studied ingredients for treatment of acne. And
Mm,
acne is often produced by or created by too much sebaceous glands on the skin cells. And retinol works by reducing the amount of sebaceous glands that are on the skin. And through that, it helps with treatment of acne. Retinol also has a lot of evidence in preventative prevention of the skin, fine lines and wrinkles and
mm,
for building collagen. So when it comes to that indication, it helps promote production of what's called fibroblasts in the skin cells. So essentially what we have in our skin is collagen. Collagen sort of keeps the skin full and youthful and fluffy, if you will. And as we age, we start losing some of that collagen, and that's why people experience some hollowness of the face and some fine lines and wrinkles. So the way retinol works is it increases cell proliferation. Basically, it increases cell turnover, and it sort of gets rid of the superficial layer of the skin for healthier, new, bright skin. So that's basically how it works.
Okay, amazing. So you talk a little bit about prevention and also treatment. Like in that sense, could you give a little bit of your thoughts on like who is an ideal candidate for retinol use?
Right. So most most clients are ideal candidates for use of retinol at various ages for different applications. I'll just start by saying who is not supposed to be using retinol. So patients, clients that are pregnant or breastfeeding should not be using retinol. Clients that have had proven the side effects in the form of an allergy should not be using retinol, but most clients are candidates for use of retinol for different applications, either for treatment of acne or for preventative for skin lines and prevention for wrinkles.
Okay, yeah. Perfect. So the list of who it's not suited for is much smaller than who could be using it, absolutely, and who can benefit. Excellent. What are your thoughts on the best way or like tips and tricks on how to apply retinol? Like how should we be using it?
Yeah, so I find that most patients don't use retinol appropriately, or they use either too much or they use it in the beginning too frequently. With retinol, generally we start as sort of starting lightly and going slowly. And one of the important things is the amount of product to be used. I'm just going to show that basically what the amount that's necessary would be a pea-sized amount. I'm not sure if that's visible or not. So this would be adequate for the whole face. And so most people use too much right off the bat, and then they have side effects that or they have insensitivities, and then they don't use it anymore. So this amount is adequate. We start off, retinol comes in different percentages. So we often start clients with retinol at 0.25% or 0.3% once a week. And we apply it primarily at night, and we allow for the skin to get used to it. And
I wasn't sure if that was my connection or not. No, as you were talking, I heard somebody, or I saw somebody write in the chat that they have used too much retinol before, and haven't we all? It's a very easy thing to overdo.
Yeah, so it's important that the right amount of product is used. We don't use retinol around the eyes because the skin around the eyes tends to be more thinner, and it
having a little bit of a Wi-Fi connectivity issue, but I can see you now, so I think we're okay. We're back on now.
Sorry about that.
No problem.
Just gonna connect my phone. Perfect. Okay. Is that better?
Yes,
Perfect.
It is. Yeah. I don't think it wouldn't be
So what we need is a pea-sized amount once a week to start at the lowest concentration. We apply it over the forehead, on the nose, and on the cheeks, avoiding the eyes and avoiding the lips. And then going forward, as we tolerate it, we try to do it twice a week, 3 times a week, and going forward. So it's important to do it very slowly. We often apply retinol in the evening at night. It's better to avoid too much sun exposure on the days that we apply retinol. So typically we would cleanse the skin at night and then we would apply it right before bed.
Okay, that's perfect. So Jess, I was thinking while you were talking about the comment that we saw there about kind of overdoing it. So like, I know I've personally overdone it with retinol, and I think it's a pretty common thing to happen when people are starting out. Like, what would you say are kind of normal side effects of using retinol, and like what sort of things should we be looking out for?
Yeah, so it's important to understand what the trajectory of the skin's going to be as we start using retinol. The first 6 weeks or so, clients might experience some peeling of the skin. And the reason for that is it's because of the increased cell proliferation. If you have more skin turnover, then you are going to see more dead skin that comes off, and that's basically what's the peeling that clients see. So the first 6 weeks, clients might see some skin peeling, perhaps a little bit of a redness, but after 6 weeks, they will have the best skin of their life. So it's important to understand it takes a while for it to work up to that level. So some degree of peeling is expected, some degree of mild redness may be expected in the short interval, but in the long term, it shouldn't be happening. One thing I want to point out is the importance of sunscreen when we use retinol. As you imagine, when the cells have increased turnover, they're going to be more sensitive. So if we don't apply enough sunscreen to protect it while they're proliferating and they're increasing in number, then someone might get more side effects or redness throughout the process.
Absolutely, you got to protect the investment that you're making. Yeah, I saw a couple questions come in. I think we can maybe get to them at the end of a Q&A, just about like how to correct sort of wrinkling around the eyes and maybe some retinol for the next. We can absolutely. I just want to let everybody who's asking them know that we will get to them for sure. So on the topic of side effects, like, are there any things that you would suggest to kind of like look out for? Like, is there anything that would be sort of like a ding, you should go see your healthcare professional?
Right. So follow up in that first initial 6 weeks is really important. So that patients understand what is an expected progress of retinol use and what is a side effect. So nobody should have patchy areas of skin irritation. Nobody should have burning. Sometimes people get a very mild tingling when they start using retinol, especially earlier on as their skin gets used to it. But there shouldn't be any burning. There shouldn't be any patchy areas. Those would be side effects, and those would be some things to talk to someone about.
Okay, and I've personally experienced like using a good moisturizer or an emollient can really help to kind of curb the sensitivity. Is that like, what are your thoughts on using moisturizers on like with retinol?
Yeah, some people do experience some degree of dryness of skin when they use retinol, and so a good moisturizer would be good to hydrate the skin back.
Okay.
Yeah, for sure.
So retinol, moisturizer, sunscreen. That's the routine.
Yeah. And you start slow and then build up gradually. You start at a low concentration once a week, and you tolerate to ideally higher concentrations on a regular basis.
Okay, perfect. So I wanted to, before we get to the Q&A, I wanted to spend a little bit of time talking about some kind of common myths surrounding retinol use. So I'm sure you've probably experienced this in your work, Dr. Tashakkor, and I know these are questions that I get asked all the time. So I thought we could sort of present the misconceptions that we hear and explain a little bit about that. So The first myth that I would like to bust, is retinol an exfoliant?
No, the short answer is no. It is not an exfoliant. As we have increased cell turnover, you do experience some peeling of the skin. That is normal in the beginning as you get newer skin. So the peeling that people see, sometimes they think that their skin is being exfoliated,
Yeah.
but no, it's not an exfoliant.
Amazing. So you can actually use exfoliants kind of on opposite ends of the day of retinol, and you wouldn't be overdoing it. It
No,
complements,
no,
right?
I would use a gentle exfoliant,
Mm-hmm.
and what it actually helps to clear off the dead skin in order for the new skin to sort of develop and come to the surface. So it would be reasonably paired with a very gentle exfoliant on top. Yeah.
Okay, perfect. Um, the next one is the biggest myth that I have heard with retinol is, does it thin the skin?
No, the short answer is no. So I think patients might experience or think that it is thinning the skin because their skin might become sensitive earlier on,
Mm.
but it actually thickens the skin. So because it increases collagen production within the tissue of the skin by increasing fibroblast proliferation, it actually does thicken the skin, and so no, it doesn't really thin the skin.
Okay, that's my favorite one. I think you're right. Like the sensitivity, the dryness sort of leads people to believe that their skin is thinning, and I think it's probably one of the reasons that people are less inclined to use it. But like, yeah, you put it exactly, exactly. Like that was exactly it. That it's thickening the skin. We're building density, and that's why it's such an amazing anti-aging product. Um, all right. So, was there any other tips that you wanted to share, or we can jump into the Q&A and take a look at the questions that have come in?
Yeah, I think that again, the only thing is many people, there's different types of retinols in the market, and there's over-the-counter ones, there's prescription ones, there's medical grade ones. And I find that most people try it once without understanding how it works, how long it will take to see the results. And because they get the peeling, they get turned off and they just put it away. And unfortunately, they miss out on the benefits, the long-term benefits of it. That's been very well demonstrated. So I think when people start retinol, it's good to have the healthcare team wherever they see their team to support them, tell them, okay, this is not an allergy, this is expected versus this is an
Mm-hmm.
allergy. I think people need that follow up at least the first 6 weeks until they get used to it. Otherwise, unfortunately, people just they stop using it. So
Yeah,
maybe talk to somebody as you start and go through the journey with them.
absolutely. And
The
I
other thing
can,
is sunscreen is extremely
yes.
important. Again, it works well as long as you protect your skin. If you don't protect your skin, you're gonna have some redness. Whatever sunscreen people use, a good amount is very important. You wouldn't want to sort of put on retinol and go to the beach and not put any sunscreen on. You're gonna have purpose, right? Uh, uh, yeah.
Absolutely. Yeah. That is a very good point. A high quality photo protection to make sure we're protecting our skin and our investment and our health overall. Absolutely. Um, I know I can personally attest that your team at NexxMD are like retinol experts. So if anybody has any questions or wants to get started on their retinol journey, like they'll be the best people for you to go to have that support. So just wanted to share that with everybody listening. All right, let's take a look at some of the questions that have come in. So, okay, so I see one here that's asking about retinol for the neck. So, Dr. Tashakkor, like, what are your thoughts about retinol use for the neck? Yeah.
Yeah, so generally I don't recommend it. The texture of the skin around the eyes around the on the lips and also on the neck is different from other areas of the face. And so retinol, I think that different concentration of retinol may be reasonable on the neck, but I wouldn't recommend the same concentration of retinol that's applied on the face to the neck. So most of the time, no, unless it's assessed and the right concentration is selected. So.
Perfect. Yeah, actually, with SkinCeuticals, we have a retinol specifically for the neck that you're completely on target there. Like it's a lower concentration, so it's meant for the sensitive area.
Right, yeah.
But yeah, I think sometimes like the even 0.3 or like a low concentration, while it sounds low, it's just
For
such
most
a
people,
different
it's too
different
much,
skin.
and they might experience the side effects. Yeah.
Exactly. Okay. So the other question was, like, what about the eye area? Like, what do you recommend as sort of anti-aging or preventative measures for wrinkles around the eyes?
Yeah. So I mean, there is neurotoxins which are great for treatment around the eyes. Outside of neurotoxins, fillers, and PRP. In terms of products, I like vitamin C and growth factors around the eye. I think that effective things. So a good vitamin C and a good growth factor would be my go-tos for those areas.
Absolutely.
Sometimes patients have certain ethnicities have a little bit of a hyperpigmentation under the eyes, and it's not a hollowness that requires injection with filler. It's a hyperpigmentation, and that requires a specific approach with certain products. But generally, I think anybody could use growth factor or vitamin C for anti-aging around the eyes.
Absolutely. And SPF.
Of course,
Totally.
yeah.
Yes. Got to protect as well. Okay, I think that was the questions that I can see. If anybody had anything else come up while we were chatting, feel free to type a question in and we can get to it right now.
And I'm happy to take questions later as well too. If there's anything, then of course we could address it if they message us. Yeah.
Perfect. Okay, so I don't know that there's any more questions. Dr. Tashakkor, if it's all right with you, I just wanted to take a minute to talk about this retinol challenge that your team is doing, and then
Sounds
we
good,
can.
yeah, of course.
Okay, perfect. So in partnership with the team here at Nexx, myself from SkinCeuticals, we're doing a retinol challenge this month. The idea being to bring awareness to the use of this like incredible active ingredient and get people started on a routine that will work for them long term, so they can stick with it, because it's a tricky active ingredient to work with if you don't have the right information. So thus providing information. We also have some exciting sort of gifts for our listeners. So for coming into Nexx and purchasing a retinol this month, we would love to see your progress. So by sharing a photo, a video, a reel here on Instagram and tagging Nexx and SkinCeuticals, you will actually be qualified for a complimentary Nexx signature facial. So super excited about that. And we hope to see you here, just located in Edgemont Village in North Vancouver.
Sorry, I do want to. This is a good question. Somebody asked, is prescription retin A the same as retinol? That's a great question. So there is the spectrum of retinoids, which are all vitamin A derivatives. Retinol sort of falls in the middle. The prescription retin A, which is more sort of retinoic acid, is more towards a potent side, higher percentages, and then there's over-the-counter products. And so depending on how strong the ingredient is, the efficacy is more, obviously it works a lot more intensely, but the side effects may be more experienced. So that's why a 1% retinol requires retin A requires a prescription versus there's over-the-counter products that don't. So retinol sort of falls in the middle it's sort of a happy spot where it doesn't require a prescription. It doesn't really cause significant sensitivity of the skin, but it is effective and it works in a matter of the weeks actually people see. So that's a good question.
Perfect.
There was also another question, I think. Can you see?
Yeah, someone was asking what they need to do to have skin like yours.
SkinCeutical facials, Botox. That's it, really. I exfoliate. I use a gentle cleanser. Same things.
And sunscreen. Don't forget that.
Of course. Sorry, I interrupted you. Go ahead.
No, you did not interrupt me. I saw this other question that was about SkinCeuticals. Do you mind if I answer that one quickly?
Please go ahead, of course.
Okay, perfect. So the question was, are there any moisturizers or products from SkinCeuticals to go along with retinol? And the answer is yes. So my favorite retinol kind of adjunctive product is called Triple Lipid Restore 242. So this is a very rich emollient that we can use to help repair the barrier of the skin, to decrease sensitivity to things like retinol or even everyday kind of irritants. It is non-comedogenic, so it's suitable for all skin types. It also has a really nice, fresh essential oil component. So it has a scent of lavender and rosemary and peppermint. So it's just a very lovely aromatic experience. That's my favorite. Okay. Yeah, someone's saying microneedling and retinol. Oh, is that a question? Do microneedling and retinol go hand in hand?
Not directly. So on the days that people use retinol, I would recommend avoiding certain procedures. I think, for example, waxing eyebrows or doing waxing around the lips or anything on the next day after using retinol of the week, I wouldn't recommend. I would space out microneedling and using retinol by a couple of days. But they go complementary, but I wouldn't necessarily do them back to back. So I would give a little bit of a space between those two.
For sure, allow our skin to recover a little bit.
For sure, yeah.
All right, amazing. I don't know that I see any other questions. Like, I think we're happy to stay on for if there's anything else. But
one last thing, I do want to talk about the skin scope. We did post the picture of it on our page as well too. It's super cool for clients that want to visually see their skin and the areas that could be improved. And there's a picture of it on our Instagram. Please take a look at it. And so what we offer is individual consultation with this skin scope. And what that allows us to tailor the treatment of each person based on what they see. And people could actually see, the things, the pigmentations or signs of aging, that it makes explaining skin products and what they need and what they don't need a lot easier. So it's a great tool that we use, and I encourage everyone to take a look at it. I think they're going to
absolutely, and we'll be posting some sort of dates that your clients can book in for skin scope consultation. So keep an eye out for that, everybody. Somebody asked if we can save the live. Yes, of course we will. And how can we book an appointment for the challenge? So no appointment needed, just come into NexxMD. Like, the whole team is just completely well-versed on everything. So they'll be able to answer any questions that you might have and get you set up with the right concentration of retinol for your skin. Okay. Amazing.
I think that's it.
Well, thank you so much for your time and for sharing your expertise on this topic. I know, I learned a lot, and I'm sure that the audience did as well. I can stay on in case there's any other questions, but thanks so much again, and it was a pleasure.
Thank you, Madeleine. I appreciate it. Thanks for the invite. Take care.
Bye.
Bye.